Hi everyone, my name is Clémence Feller and I'm a PhD student at the University of Geneva, working in the lab of Professor Maud Schneider and of Professor Stéphane Eliès. And I'm really glad to be here today to present you my later work that is about psychotic experiences. So let me just share my screen. So here it is. So the title of the latest paper, my latest paper was Psychotic Experiences in Daily Life in Adolescents and Young Adults with 22q11.2 deletion syndrome, an ecological momentary assessment study. So first of all, why did we focus on 22q11.2 deletion syndrome in this paper? So as you may know, 22q population represent a higher risk to have psychosis or psychotic symptoms. Up to 40% of adults have psychotic disorders. And the other thing is that we focused on adolescent, early adult in this paper, because psychotic experiences are especially higher during adolescence, even in the general population, but even higher in 22q. And psychotic experiences are not as strong as like psychotic symptoms. It's just that they are below the threshold to be named actually psychotic symptoms, but are still of a psychotic quality. And how do we assess those psychotic experiences? So classically, we would use the SIPS, that is the classic interview that is considered to be the gold standard that allow you to assess positive and negative symptoms of psychosis, but that actually give you little information about how these symptoms fluctuate in daily life, for instance. So it's really super helpful to make a diagnosis and to be more precise in what kind of psychotic symptoms are experienced, but then it does not really allow you to understand how it can fluctuate during the day. And to do so, another method can be used. It's the Ecological Momentary Assessment, so it's the EMA. That is a structured diary technique that collects real-life measures in the everyday life context. So concretely, it's an app that you can download on a mobile phone, and in which you can assess all the questions you want. So in the present paper, we focused on psychotic experiences, obviously, but you could ask whatever you want. And the advantages of this method is that you can do multiple assessments per day. So here we assessed participants 8 times during 6 consecutive days. So that allows you to collect a lot of data actually. So what did we do? We recruited 37 participants with 22q with a mean age of 18 and 49 participants control from the general population. And as I said, we focused in adolescents and young adulthood, so our age range was from 11 to 27. And we used the SIPS, so the classical structured interview for psychosis risk syndromes. In the present paper work, we focused only on positive symptoms, such as perceptual abnormalities and hallucinations, for instance, and also the EMA. So the question we ask, which with the mobile phone, and here we focused on positive effects such as happiness, self-confidence, feeling relaxed, and so on. Negative effects as being anxious, being stressed, being sad, being angry, and examples like that. And of course, psychotic experiences with questions such as hearing or seeing things others don't hear or see, or being on our guards, I don't feel safe, for instance, and also having the feeling that the imagination is mixing with reality. And what we observe is that this does not come as a big surprise, but as expected, the 22q participant experiences a more severe psychotic experiences. So you see here that it's higher. The yellow line is higher than the red, who are the control participants. And it was also much more frequent. So you see here, it was twice as much frequent than the typically developing peers. So as I said, this is not really surprising. As we said in the introduction, that psychotic experiences are often more experienced in 22q. And another interesting finding was that in both controls and 22q participants experiencing psychotic experiences was associated with negative effects. So again, it came quite logical to think that if I feel like my imagination is mixing up with reality, I would feel a bit anxious about that, for instance. So that was the case both in 22q and in control, so it's not specific to 22q. And more interestingly, we made a correlation between the symptoms observed with the SIPs, so the gold standard measure, and the EMA, and we saw that it was really strongly associated. So this is quite a good news. It means that with the EMA, we can actually measure psychotic symptoms as well. And even more interestingly, we used the SIPs to distinguish two groups of 22q participants, the one with strong psychotic symptoms and the one with less strong psychotic symptoms. And what we see is that the one with strong psychotic symptoms at the SIPs also report more intense and more frequent psychotic experiences in daily life. So that is quite interesting because it means that it's also a tool that allows you to actually distinguish between the groups. So what is important to remember? First, in this paper, we replicate previous findings such as the psychotic experiences being more intense in 22q. We also saw that it's more frequent. And we saw that the association with negative effects was not specific to 22q. It was also the case in typically developing peers. Another important finding is that it is associated with the gold standard measure, so with the SIPs, meaning that EMA is a sensitive measure to assess psychotic experiences. And so why is this important? It is quite important because the SIPs is time demanding and not all the psychologists and doctors are trained to actually use it. So it means that you could use EMA to actually monitor the symptoms, to do a follow-up, because the general recommendation are that you evaluate psychotic experiences every 3 months, which is quite demanding. So with this app, what's the advantages is what we could actually use it to follow up participants and to monitor them, to make sure that they don't suddenly increase their psychotic experiences and it's not seen by anyone. So that's one of the important findings. Another thing is that it could be used to adjust the intervention and the treatment depending on how the person responds. And finally, it allows access to daily life fluctuation. So we did not go into those details here, but if you remember in the results, the line that you see here is the variability actually. So you see that in the 22q, it's really super different between the individuals. And we could actually go one individual by another and see how it actually fluctuates during the day and maybe see if it is associated with something, what triggers that, is there specific events that suddenly make psychotic experiences become more intense, and so on. So the take-home messages is that the EMA provides new intel about psychotic experiences, how psychotic experiences are lived in daily life, and is a promising way of symptoms assessment and monitoring in the future. So I'd like to thank you for your attention and also to thank my colleague who made that work possible.